Now go to interview and history taking strategies. The topic is functions of interview and health history. In taking histories, follow each line of thought. Ask no leading questions. Never suggest. Give the patient's own words in the complaint. By Sir William Osler. Interviewing and taking health histories serve 5 major functions. First, it establishes the initial bond between provider and the patient. Number 2, it lays down the foundation for subsequent clinical decision making. Number 3, it provides a legal record of the subjective and objective data elicited during the clinical interview, which drive clinical judgments. Subjective data are the information that the patient or other informant provides during the health history. They are so called because they reflect the patient's perception and recall of his current health needs and past health. Perception and recall are subject to many influences that make the information less quantifiable and open to multiple interpretations. In contrast, objective data are measurable and verifiable, such as test results and physical examination findings. Both types of data are subject to error, and both are critical to the caregiving process. Our perceptions filter all our experiences and significantly influence our behavior. Successful patient outcomes are dependent upon successfully integrating both subjective and objective data to formulate individualized plans of care to which the patient will adhere. The health history contains predominantly subjective data. Data such as test results or copies of past medical examinations supplement the information that the patient provides during the interview. The combination of subjective and objective data constitutes the patient's database. Number 4, it fulfills a critical component of the documentation required for third-party payer reimbursement for clinical services. And number 5, it serves as an essential element in the peer review process for evaluation of clinical practice, such as application of evidence-based practice and identification of desired patient outcomes. Why do we interview? Building a sound provider-patient relationship is essential to effective clinical management of patients, especially with complex health and illness needs. Mutual trust is a critical element in this relationship. Also important is the ethical principle of autonomy, which places ultimate healthcare decision-making in the hands of the patient. The ability to exercise self-determination is greatly facilitated by clinicians who actively seek to engage their patients as true partners in the caregiving process. The old adage, knowledge is power, is a key to patient empowerment. Patients must feel involved in their healthcare. How the clinician conducts the initial health history and subsequent data collection interviews exerts a profound influence on the nature of the provider-patient relationship. The clinician and patient form a dyad. In order to guide the patient's decision-making processes and to facilitate adherence to therapeutic interventions, the clinician and the patient must form an ongoing partnership built on mutual trust and respect for the patient's active role in making healthcare decisions. Thank you so much for your attention.